Hey everybody, Gross Anatomy meets Grey's Anatomy and Hashimoto's thyroiditis. Check it out. Welcome everybody to Gross Anatomy, where we explore the sights, smells, and sounds of... What do we explore the sights, smells, and sounds of?
Medicine and how it relates to pop culture, books, movies, TV, and the world around us.
And there you go. And I'm Dr. Jason Cohen, losing my mind because I'm running out of town in less than 24 hours. And who are you?
I'm Lauren Taylor, and I am not going on a fancy vacation, but you will be missed, Dr. Cohen.
Thank you. I appreciate that. Yeah, I'm running away, everybody. I'm escaping. One of my best friends who I've known since nursery school. A friend since nursery school's daughter is getting married, and we're all going. Today we're talking about diseases, right? All these cool, interesting diseases that are going on in the world of celebs.
So just get into it.
Let's just get into it.
So I have been reading in the news, like Kelly Clarkson. I don't watch the Kelly Clarkson show. I believe my mom does. I know she's super popular, but like she's been disappearing, and like what happened to her Vegas residency? Why'd she like cancel shows?
Mm-hmm.
And then it's like you never want to just like make up rumors or why she's not showing up. But is she being a diva? All that. I'm sure that was going on.
Right.
It was a lot sadder. It was because her ex-husband, the father of her two children, died of melanoma. He had been diagnosed. I guess he had been battling it for 3 years, which I was just shocked because I guess I'm naive. I mean, I know we've talked about skin cancer before, but I thought melanoma was usually something people could treat and survive.
Yeah. There are a bunch of skin cancers. You know, when people talk about skin cancer, usually they think of the treatable, curable ones, which are squamous and basal cell cancers, and all of the skin cancers are really sun exposure associated. Melanoma, interestingly, can also be like a genetic cancer or familial cancer as well. And theoretically, they could all kill, but typically the more benign, non-aggressive cancers of the skin cancers are the basal and the squamous cells. Those are the ones, I had a little basal cell. You hear everybody go, and I had my dermatologist burn it off kind of thing. That's what basal cells and squamous cells usually.
That is what I'm familiar with. Okay.
Exactly. And those are the ones, like, as long as your immune system is okay and you're healthy and you don't ignore it, usually they're pretty treatable most of the time. Melanoma too, like if caught early, it could be also treatable. And melanoma tends to be one of those cancers that tends to spread distantly and tends to be more aggressive. Whereas the squamous and the basal cells, the common skin cancers, those tend to spread. If they are going to spread, they just spread locally. They get bigger or they get deeper. Whereas a melanoma, you could have this teeny tiny little skin cancer from a melanoma skin cancer, and that could potentially have already spread. So that's the thing about the melanoma, is that theoretically melanoma could be a more aggressive cancer, and we treat it much more aggressively too. And usually the first place it spreads to are lymph nodes, but then it could spread to other parts of the body as well.
So I guess, unfortunately, you've seen patients not survive melanoma.
Yeah. Interesting fact, just getting in terms of pop culture, we talked about the Bob Marley, who died at a young age of even a rarer form of melanoma, which was what I think was on his toe, a subungual melanoma, which is often, misinterpreted for like trauma. You think, oh, I banged my toe, and it looks like that same kind of thing, like those weird black and blues in your nail bed. And that, if ignored, and if it's not a trauma, a hematoma from that, it potentially could be a melanoma. So if you have something weird on your toes, go get it checked out. We had this woman years ago, right after, more than 23 years ago, I think, when I was a brand new cancer surgery attending. We had this woman come in. At that time, I was running the cancer clinic at the hospital. They had made me the director of the cancer clinic. And we had this woman come in. I'm pretty sure I've told this story, but since we're talking about this woman came in with a tumor growing off of her ear. And I think it possibly had been a rare form of skin cancer, either a melanoma or something called a Merkel cell tumor, which is kind of like a melanoma, but sometimes. But this particular cancer was involving her entire ear, and she came in with her head all wrapped. And the reason why it had gotten that far was she knew it was involving her ear. She didn't want her ear to have to be removed. But sure enough, when she took off her head wrap, as soon as she took off her head wrap, zillions of maggots, and I'm not exaggerating, zillions of maggots fell off the tumor and were just crawling all over her neck and her shoulder. And then as we're talking to her, the maggots all got sucked back up into the tumor. Eventually she did die. I mean, we treated her. We unfortunately did have to remove part of her skull and the ear, obviously, to get it out. And eventually it had already spread, I think. We were treating that just because it was, to clean it up and everything. But I remember also around the same time, a patient came in, similar thing, I think, started with something in their foot. And this particular melanoma had kind of taken over her entire leg, lower body, groin, and somewhere I think I still have pictures of it. Her entire leg was this, and melanoma tends to be a pigmented cancer. It turns black or blue.
Okay, so that's what to look for. Okay.
Yeah. And this entire woman's leg going all the way up to her crotch and abdomen were basically this blue-black fungating crazy tumor. And unfortunately that, we just had to put on comfort measures because it was already, the only way we could have saved this patient was cut off literally half of her body, and it had already spread. But I remember how tragic seeing that was. But those are really rare that's really rare.
Did she just think that she hurt herself? Like, why didn't she go? I mean, I know a lot of people, just like your show, Take My Tumor, there's reasons people can't see doctors. It's not just because they're naive. Like, they're in a remote area, they don't have access.
There's a big component of fear too. Unfortunately, I don't particularly remember, in that patient's case, the patient already was so out of it and in a horrible condition. I don't even remember having many conversations and things, and it was so long ago. But typically with skin cancers, especially melanoma, you look for anything that's growing, anything that has irregular borders, if it's specifically darker, perhaps, if it's like flaky or raised or anything like that is a cause. When in doubt, I always say, when in doubt, get it checked out. When in doubt, get it checked out.
For sure. And so I was just curious, people with freckles, like I know my mother-in-law has to have like the full body, like dermatology check every, I think, few months or every 6 months.
Yeah.
Is that so people with freckles, are they more likely to get melanoma? Is that true? Or like people with lighter skin, or there's probably nothing.
People with lighter skin, with sun exposure, with history of sunburns, those are all the things. Certainly there's a familial component too. And then the thing about melanoma is A, B, C, D, E. That's what the thing is, A, B, C, D, E. So A is asymmetry, if it's not a regular shape. Border irregularity is B. So asymmetry, B is border. C is a color variation. If it looks, different colors, multicolored. Diameter change, meaning if it seems like it's grown or evolving or changing spots. So that's A, B, C, D, E. And those are all reasons, if you have a mole, that you've had forever and it hasn't changed, the odds are it's nothing. But if any A, B, C, D, E occurs to any of your freckles or skin lesions, go and get it checked.
Okay. Good advice. Thank you, Dr. Cohen.
Thanks, Lauren Taylor.
Another thing I saw in the news, I know we both, I feel like, stopped watching Grey's Anatomy around the same time. This actress I'm not familiar with, but hopefully I'm saying her name right, Camilla Luddington. She played Dr. Joe Wilson on Grey's Anatomy, but she didn't come in until 2012. And I feel like I only watched the first season or two. I don't know about you.
I didn't. I definitely, there's a chance occasionally I may have seen an episode and would recognize her, but no, I didn't necessarily know her.
But she was diagnosed with Hashimoto's disease, which I'm actually familiar with because I have a friend that has it. And she showed me the bottom of her tongue. And it was all like full of like circles and looked very odd. And apparently that's a symptom of that disease. But I feel like you know more about it than I do. What?
The circle tongue thing isn't necessarily... I'm Googling pictures of her to see if I recognize her. I don't know if I really recognize her.
Yeah, I didn't really either.
Yeah, I don't recognize her, but yeah, Hashimoto's thyroiditis. It's a thyroid thing, so definitely I deal with it a lot. It's not usually a surgical disease, so it's not specifically something patients see me for because it's usually something medical. Occasionally, we may operate on someone with really bad symptoms of Hashimoto's. The thing about Hashimoto's is it's actually an autoimmune disease, like types of arthritis, like inflammatory bowel disease, like a lot of those kind of things where for whatever reason we don't really necessarily know why the body decides, hey, I'm going to attack myself, and the
Mm.
thyroid gets attacked in this particular case. And the interesting thing is there are two presentations to Hashimoto's thyroiditis. Itis just means inflammation. So there's the initial phase of Hashimoto's thyroiditis, which is um, the initial inflammation is occurring on the thyroid. So sometimes actually patients come in during that inflammation with pain and soreness and
Mm.
discomfort and trouble swallowing, and the thyroid's red, and that's sometimes why we might operate on a patient with why I might operate on a patient with Hashimoto's thyroiditis. But usually gets better, and it gets better fairly quickly. Sometimes just with time and patience. Occasionally, a patient needs to get like steroids to decrease the inflammation. Occasionally, Advil, ibuprofen, nonsteroidal anti-inflammatory drugs help. But usually, it's more of a time thing. But the interesting thing is, in that initial phase, people's thyroid becomes overactive because that initial thyroid's getting attacked and the thyroid's responding aggressively, and people have overactive thyroid. But then what typically happens, and most people who say they have Hashimoto's ultimately, or who don't experience that initial phase, because not everybody gets that, for whatever reason, that thyroid again gets attacked by itself and it stops working. And that's typically, when someone says, oh, I have Hashimoto's, the thyroid's not working well enough, and patients basically need to be on a thyroid hormone pill to take over the job of the thyroid. And they may notice is that, they're feeling tired, and
Yep.
the thyroid regulates us. It's our metabolism hormone organ, and the hormone helps regulate us. So they're tired, they're sluggish, no matter how much they try to move. They're putting on weight, they're sleeping all the time, their heart's going really slow, and all that. They're cold all the time, and those are some signs of Hashimoto's thyroiditis. The interesting thing is operating on a patient with Hashimoto's thyroiditis is um, the thyroid is like almost not even there. It kind of even, they have this teeny tiny thyroid. And it's sometimes hard to operate on because it's like, where is it? Like if you have to operate on a patient who develops a cancer with Hashimoto's or for some other reason, that thyroid kind of disappears, and it's a kind of weird, interesting thing because the thyroid's been attacked. The other interesting thing, sometimes a patient with Hashimoto's thyroiditis develops a cancer of the thyroid, and we operate on them. And that inflammatory phase of this is a very medical episode, Lauren
Yeah,
Taylor. I
no,
was
it's
thinking,
been interesting. I didn't
there
know.
you go.
I didn't even know you could do anything surgically for this. Okay.
Yeah, and operating on someone with active Hashimoto's thyroiditis, because it's inflammation. People, anytime there's inflammation, you could have swollen lymph nodes, and just because someone has swollen lymph nodes when you're operating or when you're doing an ultrasound on them for thyroiditis doesn't mean cancer. So you'll sometimes see a patient who you're operating for cancer who has Hashimoto's thyroiditis, and you're seeing all these lymph nodes, and you're like, oh my God, this patient has all this cancer spread in their lymph nodes, and you wind up taking them out, and the diagnosis is, yep, Hashimoto's thyroiditis, inflammation, and so there's a good thing to it too, and it's often a patient who's nervous, they have cancer, they have lymph nodes. Often you could reassure them and say, listen, it's theoretically yes, could there be cancer in those lymph nodes? Yeah, but often it's more that there's an inflammatory reaction to the Hashimoto's, which is just an interesting thing
Yeah.
surgically that we see.
Well, and this Grey's Anatomy actress, she said she was actually relieved to get the diagnosis because she had been feeling, like you said, sluggish, and she just couldn't figure it out, and she felt like she was being a bad parent. She just like couldn't get it straight, and then she got this diagnosis. So.
Yeah, the interesting thing though about that is um, everybody, to some degree, it's so common to feel that way,
Mm-hmm.
and you feel yucky, you feel tired, you feel weak. To some degree, that's life, or it's part of
Right.
aging, or if you're not, it's kind of like you got to push yourself in order to start feeling good. You're not going to like feel good all of a sudden, if or it could be a million other things to feel that way. So a lot of patients often come in to me, even though I'm a surgeon, saying, I must have some kind of thyroid problem because I feel
Mm-hmm.
tired and yucky. And the reality is most of the, sometimes, you have to rule that out. You have to make sure it's not that. But most of the time, it's something else or it's life. And it's just, you got to kind of start moving, and then hopefully you'll feel better.
Well, so that was going to be something else I was going to talk to you about. So there was this disease I've never heard of, and unfortunately, we already did the episode with Dr. Lisa Cook, the neurologist. But
Yes.
this, and I know you know tennis better than I do. So tennis star Monica Seles, I guess because it's about to be the U.S. Open, she came out, or maybe it is the U.S. Open now. I don't know. I don't follow tennis, but she came out and said that she has been diagnosed with Myasthenia Graves.
Myasthenia gravis. Myasthenia gravis. Yeah.
And that she just wanted. I guess she's been dealing with it for 3 years. It says,
Yeah.
and she just wanted more people to be aware of it, which I had never heard of it. I guess it's referred to as MG.
MG. Yeah. It's not really that common a disease. It's not something. I think in my lifetime I've seen maybe a handful of cases. In fact, the only case in particular that I remember is just someone I knew from synagogue, believe it or not, who had myasthenia gravis. And because I was a doctor and a surgeon, of course, he came and talked to me and would discuss it with me and ask me my advice and my thoughts and things like that. But it's could be just like this progressive disease where you experience weakness. Your neurons stop working because some of the neuromuscular chemicals in our body aren't proper. Things just aren't working, and the main thing people develop from it is weakness, right? Is that what Monica Seles is complaining of?
Yeah, it was weakness, and I know you treat Graves' disease, and so I was wondering if it was like similar. So I looked in, and it was like, no, they're both autoimmune diseases, but totally separate. So I was wondering if like people had ever come to you with MG and you had to refer them to a neurologist, thinking it was some other autoimmune, like thinking it was like Graves' disease or something else.
That's a great question. I love that question. No one's necessarily come to me with that. I think I've seen some patients who have it. And the interesting thing is, if you're operating, the nice thing is it's often progresses slowly. There are treatments for it. But operating on a patient with that, I've operated on some patients with that disease, you definitely have to be aware of it, you and your anesthesiologist, because this patient has problems with the neuromuscular system and all their muscles. So, and when you do anesthesia, especially general anesthesia, you're stopping all that. You're blocking all their muscles from working. So you have to be extra aware and cautious. And there are definitely things that our anesthesiologists have to do and be aware of in treating and putting them to sleep to make sure that they wake up and they start moving again and breathing again, because the breathing function even necessarily may not work. So you have to be extra kind of careful and keep an eye on them and make sure they're really awake and up before you kind of sign off on them.
Yeah. Okay. Yeah, I had never heard of it. So, I mean, I do think it's cool when celebrities are like, hey, I have the, at least it's more in the public knowledge, because maybe there are other people that read that story and possibly do have it or some of the symptoms.
And the other interesting, as a surgeon, the other interesting thing about myasthenia gravis is sometimes there is a surgical treatment involved in patients with myasthenia gravis. The thymic gland, we don't necessarily need so much, except for it helps with our immune system, everything. We need it earlier in life. We don't necessarily need it so much later in life, but it does help with our immune system. The thymic gland sometimes is what contributes to myasthenia gravis, which is really interesting. And some people develop tumors of their thymic gland, and about half of those people who develop tumors in their thymus, in their thymic gland, develop myasthenia gravis. So sometimes, if someone develops myasthenia gravis, you want to automatically say, do they have a tumor in their thymic gland? Because half of the people with tumors in their thymic gland develop myasthenia gravis. And if you could remove that thymus, you've cured the patient, which is super cool. Yeah. And then there are even patients without that who just removing the thymic gland sometimes will help the symptoms related to myasthenia gravis. So, I don't fully know. I don't even know if 100% it's totally understood why and how all those mechanisms work, but I know it's one of the
Mhm.
treatments.
Okay. So, I mean, well, there are treatments. That's great because I didn't really know anything about Monica Seles, but apparently she's already been stabbed. So I think she's had it hard. Apparently, like, I don't know if she was 16 when she was young and had to wait 2 years to play again or something terrible.
I vaguely remember that. She was a pretty big tennis person in the 90s, I think. Yeah, I definitely remember, she was up there.
Yeah. Seems like she didn't have an easy road.
The other day, I actually removed part of a thymus because one of the surgeries I like to do the most is parathyroid surgery. And sometimes someone's parathyroid gland could be hiding in the thymus. So sometimes you actually have to remove part of the thymus to cure someone's hyperparathyroidism. So the other day I was hunting for a parathyroid and I had to remove part of their thymus to get it out.
So, how does that affect them when you remove part of their thymus?
Really doesn't affect them at all. They don't
Nice.
miss it. You don't really need it.
I've never heard of that. So, is it kind of like the appendix, which I don't have? Like, you don't I'm sure it's very different.
Yeah, it's not. It's definitely very different. We definitely need our thymus earlier on in life for our immunity, T cells and things like that. But although some people think that the appendix to some degree is also involved in the immune system, but there's so much we don't know. There's so much we don't know.
Exactly.
Exactly.
Yeah, I'm going to get to the bottom of all this medical problems in the world.
Exactly. Gross anatomy is going to figure it out.
We're trying our best.
Exactly.
Another thing in the news was that Emma Stone reveals she's bald and wears a wig to hide it, but she's not bald for any medical reason. She's bald for an upcoming film called Begonia, set to be released in October. But she said her first shower after shaving her head felt amazing. However, she admitted that she started crying whenever she was first being shaved because it reminded her of her mother who went through, I think it was breast cancer and had to shave her head for that reason. But she said that her mother said, "Oh, I'm jealous. I miss being bald." So I guess they're just trying to look at it like through a happy lens. She's recovering, obviously. So
Yeah. One of my, I don't know if it's one of my favorite movies, but a movie I really, really liked was G.I. Jane with Demi Moore. And I loved it when she decides she's going to shave her head and
she looked good. Yeah.
She looked great. But it was just so cool. And she was amazing. That's one of my favorite movies that she's ever been in. So.
Yeah, and I don't know why Emma Stone says she doesn't want to hide it, but she hides it under a wig. I'm not sure. I feel like she could show it if she wanted to. Maybe it was supposed to be a surprise for this movie. It's unclear.
Yeah, I'd like to see her bald. I'm curious what
I
she
know,
looks
me
like
too.
bald.
Now I'm like, well, she can probably rock it.
When I was a youth, I always had kind of like my hair now, but even shorter. Like I wanted, after Top Gun came out, the original Top Gun, that was my hairdo too. I always had Top Gun short hairdo. And my friend, and each time I would go for a haircut, it would be a little bit shorter, a little bit. And my friends used to joke around. They're like, "You're not going to be happy till you're bald." But I never did the shave my head. And now I'm at the point where my hair is so thinning and I'm getting older. And I'm like, if I shave my hair, I'm afraid it might not grow back again. So it ain't going to happen.
That would be my fear too, which is probably rational.
I remember get a little sad. It's the month of August. My mother's birthday is coming up, and I remember she was getting chemotherapy for lung cancer. And I remember, when she went bald, and I remember like going wig shopping with her and her wearing her wigs. And some days she'd be like, the wig itches too much. I'm not in the mood to wear it. And, sometimes she would rock the bald look and everything. And miss you, Mom.
Hard watching
miss you, Mom.
Go through that. Yeah.
Mm-hmm. Birthday. Yeah.
Everything you've said about her, she sounds like a real sweetheart. So
she was a pretty amazing woman, my mom. She definitely was. She was everybody's mom. She was, I'm about to see one of my friends at this friend's wedding, and he hopefully he doesn't listen to get embarrassed. One summer, like a girl dumped him and broke up with him, and he basically spent that whole summer on my mother's couch crying to him as my mom being his therapist for the summer.
Aww.
And that was kind of my mom. She was kind of everybody's therapist.
And he got through it. See?
He got through it. He's married now, and he's doing great.
This isn't his wedding you're going to. It's their like.
No,
Okay.
no, it's not his. It's not his.
I'll
It's
be
not
like,
his kid's
he's
wedding.
finally getting married. So
Right.
like,
No, no, no. It's a friend's daughter's wedding who we're all going to.
I figured. Okay. Very cool. Well, that's the big in the news now celebrities health updates I got for you. But
That's a lot of good stuff.
it is. And then moving on to entertainment, which is, it's all entertainment in a way, but
It's all
you
entertainment.
sent me a list of the New York Times 100 best movies of the 21st century. So the 100 best movies since 2000, rated on by Hollywood stars. I guess I don't know how they did it, but
Yeah, it was a weird list, right?
yeah, like I don't know which actors got to vote. It didn't say, but it said Hollywood actors, I guess producers, filmmakers, they all voted on this list. So there's, I mean, you can, if you're not subscribed to the New York Times, you can go to IMDb and they have the list and all.
I don't subscribe to the New York Times. Do you?
No, I don't. So I couldn't click on that article, but I found it on IMDb. They have the whole list.
Right.
And the list is great. I don't necessarily agree with the top 10.
Right.
How do you feel?
Of the top 10, let's go through the top 10.
The top 10, number 1 is Parasite, which I do think is great. It wouldn't be my number 1, but it would probably be my top 10.
Yeah, it's definitely up there. I didn't really study that list, so I don't, because it was like, it's like so different from movies pre-2000,
It is. Well, because at first I was like, how's Citizen Kane not on here? Because
how's Godfather not there, right? I'm like
2000.
Right,
and
exactly.
One of my favorite movies, Paul Thomas Anderson had at least 2 movies on the list, the 100 list. But Magnolia wasn't on there, and it came out in 2000, which is my favorite, which would have made my top 10, but didn't.
Magnolia is one of your favorites?
Their top 100. Yeah, it's just one of those films where it changed the way I looked at film. Like how it was done, like what they did. I didn't know movies could be like that. It was one of those moments.
Really? That was a movie for you like that? Interesting. I love when those moments happen. Me
too. And another one was Inglourious Bastards by Tarantino. But that was on the list. That was number 14. That would probably be my top 10.
I didn't love it that much either. I didn't. So number 1 was Parasite. Yeah, it was entertaining. Mulholland Drive. I don't even know if I saw Mulholland Drive. Which one was that? Where they throw people off the? Is that like?
It's David Lynch, so I think that's probably why it's getting a lot of love because he died.
Is that James Madsen? Is that what James Madsen? Was he in that? The guy who recently died?
Naomi Watts was.
Was James Madsen in?
Was he?
I don't know.
It's been so long since I've seen that movie.
Wait. James Madsen is not in that. I think I'm thinking of something else. But now I feel like I definitely need to watch that movie. And then There Will Be Blood.
Love it. Love it. I agree with that one.
I got to tell you, I don't even know if I saw the entire movie of that.
Really?
I've definitely seen bits of it.
Daniel Day-Lewis? Oh my.
Yeah. No, I know. You know what's weird? All of these movies are just like weird.
They are weird. No Country for Old Men, I do like.
I didn't see that either.
Oh, I don't know if it'd be my top 10. Did you see A Serious Man, which was also a Coen Brothers movie? It made it the list. It was good.
Maybe. In the Mood for Love, I don't even know what that movie is. Do you?
I don't know what that movie is.
No. Moonlight I saw. I thought that was okay, but not. I don't know if that was a top 10 by any means. Eternal Sunshine of the Spotless Mind. I don't even remember it.
It wasn't my favorite.
No. Get Out. Okay. I don't know top 10, but it was like a genre changing movie, but I don't know if it was top 10. Spirit Away.
It's an animated. I don't know. It's on the list. I haven't seen it, but it kind of makes me want to.
Yeah. And The Social Network.
I completely disagree with. I wouldn't even put it in the top 100, to be honest.
Was Almost Famous on the list?
Yes, it was. It was up there.
That should have been way up there in my mind.
I think it might have been like, I don't know. It was definitely on the list.
I don't know. Was How to Train Your Dragon on the list?
I don't think so.
Really?
Silver Linings Playbook wasn't on the list, and that's
what?
I really like that movie.
That's true. That should have been on there for sure. You know what, though? Speaking of how things change, are you a fan of The Bear?
Yes.
Are you caught up?
Yes.
I'm not totally caught up, but I'm in the current season, and holy cow, I think it's amazing,
Me too.
amazing. Like this season is like changing the way I feel about TV, like the way you talked
Yeah.
about.
Yeah, and this season is more of feel like the creator knew it's like it's more feel good. You know what I mean? And I feel like he just knew people needed it, and it's
It's
beautiful.
so great. Yeah, it's
Mhm.
beautiful. It's beautiful. But I also love the episode was it season 1 or 2 where Richie goes to stage?
Oh, I feel like that's so many people's favorite episode. That is one of the greatest
Yeah,
like hours of television. Yeah, I
I
think it's called Forks, or it's just called something like that.
I don't remember. But this season has just been fantastic.
Yeah, I really enjoyed
Non-negotiables. Non-negotiables. I love that.
it.
Right?
So many good things. Oh, you haven't finished it yet, so you have
No,
more
can't run it.
to.
But there's a doctor in it. They have to have the doctor character.
What doctor's in it?
The bear's girlfriend,
Oh yeah,
Claire. Claire
Claire.
Bear.
Claire Bear.
So,
Yeah, she
yeah,
completed her residency.
don't ruin it for me.
I'm not. I'm just said she
Okay.
completed her residency, but
Okay. Don't
it's
ruin
not a
it.
spoiler.
Don't ruin it. I don't know what's going on.
Yeah,
Good stuff. I'm loving
it's
it.
not good
I'm
stuff.
loving the
Well,
bear. Thank you guys, the bear guys. Thank
I
you.
know
You
it
guys are
made me
doing it.
feel good. So
Yeah,
thank you.
it's such good TV. It's
Agreed.
really good TV.
I might just go rewatch that. We're
I'm
having
trying to
trouble
get my
finding
kids
stuff.
to watch it. They're not into it.
Really?
Yeah, it's upsetting. My wife certainly I get that. I'm loving it. My son-in-law likes the bear, and I'm trying to get him to get in on he hasn't started this season yet, and I'm like, Lucas, you got to watch this. It's great.
Yeah.
Yeah.
Luckily, my husband and my brother love it, so I can talk to them about it.
Nice.
Yeah.
Lauren Taylor.
That's all I got, Dr. Cohen. I feel like this is a good episode.
Yeah. Thanks for joining us, everybody. Hopefully you learned some stuff about diseases in celebrities and agree with us on the bear.
Bye.
Bye.